First, an update on latest numbers. As of 6 a.m. Geneva time today, there were 31,211 confirmed cases in China and 637 deaths. For the last 2 days, there have been fewer reported new infections in China, which is good news, but at the same time, we caution against reading too much into that. The numbers could go up again. As you know, epi curves can zigzag. Outside China, there are 270 cases in 24 countries with 1 death. As I mentioned on Wednesday, WHO is sending testing kits, masks, gloves, respirators, and gowns to countries in every region. However, the world is facing severe disruption in the market for personal protective equipment. Demand is up to 100 times higher than normal, and prices are up to 20 times higher. This situation has been exacerbated by widespread inappropriate use of PPE outside patient care. As a result, there are now depleted stockpiles and backlogs of 4 to 6 months. Global stocks of masks and respirators are now insufficient to meet the needs of WHO and our partners. WHO estimates that global frontline health emergency responders will require approximately 7 to 10% of market capacity. This percentage may be higher for other critical supplies. Frontline health workers in China require the bulk of PPE supplies. This afternoon, I spoke to the pandemic supply chain network, which includes manufacturers, distributors, and logistics providers, to ensure that PPE supplies get to those who need them. The network is focusing initially on surgical masks because of the extreme demand and market pressures. We are appreciative of companies that have taken the decision to only supply masks to medical professionals. There is limited stock of PPE, and we need to make sure we get it to the people who need it most, in the places that need it most. The first priority is health workers. The second priority is those who are sick or caring for someone who is sick. WHO discourages stockpiling of PPE in countries and areas where transmission is low. We call countries and companies to work with WHO to ensure fair and rational use of supplies and the rebalancing of the market. We all have a part to play in keeping each other safe.